One of the earlier videos that we have produced is the anatomy of the face. Brief review: skin, thin layer of fat, muscle layer, nerve, artery, bunch of fancy stuff. Connecting ligaments that connect the soft tissue to the skull, zygomatic, masseteric, mandibular, as well as a ligament right in here that connects the neck platysma to the sternocleidomastoid muscle. As we all age, it is undeniable that the forces of gravity are going to eventually catch up with us. So all these tissues are being pulled downward by the force of gravity. Now add to this the fact that we are actually losing volume. There have been several scientific studies that have shown that if you take CT scans of patients in their young 15, 20 years of age, and then look at the same patients when they're 45, 50 years of age, those patients have actually lost bone volume over that time, which means that the actual skull, you've actually lost some of the bone volume over that course of time. That's one type of volume loss. The other types of volume loss that are also happening include loss of volume in some of the ligaments, connective tissues, and soft tissues of the face. Basically, you can think of this kind of like a balloon, and some of the air of that balloon has been let out. So over time, the tissues all tend to lose volume, and then they're still tethered, so they start to sag. Now, the pattern of sagging is very, very reproducible. So since the tissue is tethered here, when this tissue sags, you're going to end up with a nice thick line right here, or the melolabial fold. Since it's tethered here, when tissues fall, you get the marionette line and the jowls. Okay? And as it's tethered here, as the tissues sag, you get the laxity in the neck. Furthermore, that platysma muscle that we had talked about earlier, when we're young, it tends to be very crisscrossed in the middle, kind of like a corset. However, as we age, that muscle tends to ply apart a little bit. So as it plies apart, you see the bellies of the platysma muscle right in here, and you get the cords of the neck. So aging in the face can be it's very reproducible and very predictable based on where these ligaments are, and you can clearly see that the anatomy relates to how we age in our face.